Melissa. My name is Sarah. I'm going to be the nurse practitioner student taking care of you today.
Yep.
Sounds like we're seeing you for a physical today?
Yep.
All right. So we'll go ahead and jump into doing a little bit of a history with you. I'll ask you a couple questions and then we'll do your exam. Sound okay?
Okay.
All right. So just mainly here for the physical, no other issues or complaints? Correct. Okay. And let's see, we'll kind of jump into your past medical history if you have any. Do you have any issues with any kind of hypertension, any disorders, medical disorders that you're taking medications for or that you're being seen by a physician for?
Nope.
Any history of childhood illnesses like leukemia or any diseases when you were younger?
No.
Okay. Any surgeries or surgical histories?
Knee arthroscopy with,
Okay.
for my meniscus, and then an ACL repair.
Okay. And any other surgeries at all?
Appendectomy and a C-section.
Okay. How many kids do you have?
1 boy, 1 girl.
All right. Awesome. And how old are they?
7 and 9.
So you're busy. And were both of those births to term? Or
Yes.
did you have any complications during pregnancy or postpartum?
Nope.
Okay, great. And was there a reason that you had the C-section where your baby's breech or?
Just not coming out, not progressing.
Okay, okay. And are you still menstruating?
Yes.
Okay, and how long are your cycles?
28 days.
Okay, and are you on any birth control at all?
No.
Or, okay. And any issues or concerns about pregnancy?
No.
Okay, and then, let's see here, any problems with heavy bleeding, painful menses, any problems during your menstruation?
No.
Okay. Any history of depression, anxiety, any mental health issues?
No.
Okay. How about your family history? We'll kind of go over that. Parents still alive and well?
Yes.
Okay.
Coronary artery disease for my dad,
Okay.
and my mom, nothing with her.
Okay. How about siblings? Do you have siblings?
2 brothers and a sister.
Okay. And are they all alive and well?
Yes.
Okay. Any active problems with your siblings that you know of?
No.
Okay. We'll go into, do you smoke?
No.
All right. Any use of alcohol?
No.
All right. Any use of illicit or street drugs, marijuana, any edibles, anything like that?
No.
Okay. Do you vape?
Nope.
Okay. Any issues or concerns with anything like ear, eye, nose, throat, any stomach pains, chest pain, shortness of breath?
No.
Okay. Any, do you do breast self-exams at home?
No.
Okay. When's the last time that you had a pap smear?
2 years ago.
Okay. And any problems with, I asked you shortness of breath, any constipation or diarrhea?
Nope.
Any problems with voiding, like difficulty with urinating, burning sensation, any problems urinating?
Nope.
Or voiding your emptying your bladder? Any problems with vaginal discharge or anything like that? Okay. How about your knees, since you've had surgery on those? Have those felt pretty good or
Yep.
any problems with those?
No.
Okay, don't feel like your knees are locking or anything like that?
Nope.
Okay, great. I did review your vital signs that the nurse took and those all look really good. So we'll go ahead and start with your exam.
Okay.
All right. So I will start with taking a look in your ears and kind of looking in your mouth, your throat, all that good stuff. And I'll just kind of take a peek. Your hair looks so nice today. Any problems with hair growth, hair loss, anything like that?
Nope.
Haven't noticed any sores or anything on your scalp?
No.
All right. No ringing in the ears, any hearing loss, any
Nope.
problems with that? Great. Those look good. We'll go ahead and take a look in your mouth. And your eyes here quick. Any problems with vision?
Nope.
Okay, and you see the eye doctor regularly?
Yes.
Okay, great. Perfect. I'll have you go ahead and follow the light for me, just not with don't turn your head. Perfect. Looks good. Any problems with your peripheral vision at all?
Nope.
So I'm gonna go ahead and cover your eye, and then, or cover the one eye, and then I want you to just tell me how many fingers I'm holding up. 2. Perfect.
2.
Perfect. And we'll do the same on this one.
2. 1.
There you go.
One.
Good. All right, so we'll go ahead and I'm gonna actually look into your nose. Any nasal drainage, any kind of issues with allergies, runny nose? see any polyps or anything. Mucosas look good. Any dry eyes, dry nose, anything like that? Nope. Okay. Will you go ahead and open up for me? Good. Any difficulty swallowing? Good, good. Alright. Do you see the dentist?
Yes.
Okay, great. Any cavities or anything like that to be concerned about? Alright, great. Let's see, and then I'll just take one quick look again at your eye just a little bit closer. Good. Alrighty. Then we're gonna go ahead and take a feel here on your, just checking your lymph nodes. Great. Any problems with swallowing?
Nope.
Haven't felt kind of full in here in the bottom of your neck or anything like that? Go ahead and swallow for me. Great. Any family history of thyroid disorders, problems with your thyroid, anything along those lines? Great. And then I'll go ahead and kind of palpate your veins here, your carotid arteries. Good. All right, that's good. We'll go ahead and move on here. Any problems with pain, like musculoskeletal pain or muscle pain in your neck or your shoulders? I'm gonna have you kind of put your head up, down, and to the side. Perfect. And then kind of over like this. Any problems, any pain, discomfort, anything like that? Any pains when I'm pushing?
Nope.
Good. I'm just gonna kind of push down your spine here. Any pains when I push there?
Nope.
Okay, any pain when I'm tapping?
Nope.
Okay, pain there?
Nope.
Great. All right, I'm gonna go ahead and just take a quick listen to your lungs while I'm on this side. Good. Excellent. I'm just gonna give a little tap on your back. Any shortness of breath?
Nope.
Nothing like that? Okay. Haven't had any coughs, colds, or anything like that recently?
Nope.
Great. All right. So I'm gonna take a quick listen to your heart now. Go right under here, sorry. Good. I'm gonna actually have you turn your head towards me, and I'm gonna just hold your breath. Good, and then perfect, thank you. Hold your breath, oops. Good. All right, that sounds great. Alrighty, then I'll have you, while we would be sitting, I would probably start with your breast exam. And since you're not doing breast exams at home, we would always encourage you to do those just because you know the contours of your own breasts, so it'd be a good idea. So I would have you put your arms at your side. Perfect. I would expose you just so I could check for any dimpling, any pendulous breasts, any kind of abnormalities noted in her breasts. And then I would cover you back up and I'll have you lay on your back for me. All right, I'll have you go ahead and bend your hips and knees for me and just relax your stomach. Perfect. Take a quick listen to your abdomen here. Good. Sounds good. I'm just gonna tap here. Good. You can go ahead and relax, and then I'm gonna have you bear down for me. Good. Perfect. I'm just gonna feel here for any pulses in your groin. Alright, great. I'm gonna feel here. Good. And we'll feel on this side as well. Sounds great. I'm gonna have you go ahead and flex your knee for me. I'll just quick do this. Any pain when I kind of rotate that in or out? Nope. Good. Right. Any pain when I rotate that in or out? Nope. Great. I'll come back up here to your abdomen, and I'm just gonna have you take a nice big deep breath in for me and out. Any pain with that palpation or that pushing? Nope. Great. Alrighty. So I'm just actually gonna take a feel here on your feet for your pulses. Well, we've got you laying down. Having any problems with any sores on your feet, rashes, anything? Nope, that you've noticed? Okay. And you said your knees are feeling good after your knee surgeries? Yep. No problems with those? Nope. Good. Great. Those feel good? Great. All right. You can go ahead and have a seat at the edge of the bed for me. I'm going to do a little bit more advanced testing if you were having a neurologic condition, so we'll test your cranial nerves. So what I will do is I want you to close your eyes for me, and I'm going to have you smell something, and I want you to tell me if you can identify that, or if it smells salty or sweet or pungent. Can you smell that?
Mm-hmm.
What do you think that is?
Alcohol.
Oh, okay, good. Perfect. All right, you can open your eyes. And we kind of already looked in your eyes, but we'll just go ahead and do that again. And so your pupils, well, let me go with that side of the work. That's good. Perfect. Great. And once again, I'll just have you follow my light with your eyes only. Great. All right. So now I'm going to go ahead and have you close your eyes, and I want you to tell me if this feels soft or sharp. Okay?
Soft.
Perfect.
Sharp.
Great. Alrighty. And I would like you to go ahead and smile for me, and then frown, and put your eyebrows up. There you go. Shrug your shoulders. Okay, great. And then I will have you actually, first I'll have you say ah for me. And can you, well, I was just going to ask you to come on, we already did that. And then I'll have you swallow for me. Great. I'll have you go ahead and stand up for me. I'm just going to have you do a couple of exercises where I want you to walk. And so I want you actually just to show me how you normally would walk. So walk to the door and back for me. Gait appears normal. Perfect. Great. I want you to go ahead and stand still for me and close your eyes. And try not to let me push you over. Perfect. You can go ahead and open. Yep. Then I'm going to have you go ahead and walk on your tiptoes. Great. And then on your way back, I want you to walk on the balls of your feet for me. Pants are a little long there. All right, great. And then what I want you to do is, if you're able, to hop on one foot for me. And on the other. Great. And then I want you to try and hop on the balls of your feet for me. That one's a little harder. Perfect. Thank you. Great job. All right, I think I'm done, Janessa, for the day. Thank you.
Sounds good, thanks.
Go outside and I'll finish. Thank you. for Janessa's exam, since I wasn't able to do a real breast exam and I was not able to do a vaginal exam, I would go ahead and expose her breasts, as I said, while she's sitting. I would have her place her arms on her waist, and I would check for any dimpling, any ptosis, or any pendulous breasts. After that, I would lay her on her back, and I would start with the right breast. I would rotate clockwise with 2 fingers, checking for any lumps, bumps, any kind of dimpling, any nipple discharge, any kind of sores or abnormalities in the breast, and also feeling for any fibrous breasts or feeling for any nodularities in the breasts. Then I would go into the axilla and perform deep palpation of the lymph nodes, and also for any kind of abnormalities in the axillary area. Then I would go and move over to the left breast and perform the same exam. At the end of each exam on each breast, I would also palpate the nipple area for any discharge during palpation. For the vaginal exam, the patient would be placed in lithotomy position with an adequate size speculum warmed with warm water, then inserted into the vaginal canal to visualize the cervix. Given her age and her last pap smear was 2 years ago, she really wouldn't need a pap smear today. So the only reason why we would do a vaginal exam would be if she was having abnormalities, but let's say she was due for that, then we would do HPV co-testing and a pap smear as well for atypical, the diagnosis or looking for atypical cells. And then if she was not due for the HPV, then we would just do the pap smear. After that exam with the speculum, we would withdraw that and we would do a bimanual palpation of the ovaries and cervix, for any tenderness or adnexal abnormalities or anything like that. That's it.